an hour of instruction tonight, and then we're going to do about 30 minutes of question and answer. So if you will type your questions in the chat box and we will address them towards the end, or you can ask them in person. And we'll get started here. So we're going to start by looking at the Dolphin Neurostim and going over all the features of it. But before I get started, I want to remind you guys, tomorrow you guys are going to get an email link from us, and you will be able to view this video again as many times as you want. So if there's stuff that you missed tonight, you can watch it again as many times as you want. You will also get an invitation to join our Facebook forum. We do recommend that you do that. It's a place where practitioners and anybody who uses equipment can ask questions. And those of us who've been doing this for a while will get on and answer questions for you guys. You can also link up with people in your area who might be able to help treat you. So anyway, it's a nice feature to have, and I do recommend that you guys do that. And we will also let you know periodically if there are workshops coming up either online or in person in your area. So anyway, it's a great thing to do. So starting with the Dolphin Neurostim, without further ado, starting at the tip here, we have an alloy tip. It's like a brass alloy that's biocompatible. You'll notice that it is a retractable tip. So if I push on it with something hard, it does kind of retract back into the tip here. So it's spring loaded, and because of that, we do recommend that you clean these, but when you clean them, you don't pour liquid on here because it can get down into here and it can interfere with the conductive medium between the tip of this and the electronics itself. So clean it carefully with an alcohol wipe, and that should be all you need. Moving up from there, we have what we call the go button here. So when you're holding this down, you're actually doing a treatment when the unit is on. So you're going to have two ways to activate a treatment. One is going to be by holding this button down. But notice it doesn't do anything when the unit's off. Moving up from there is there's a roller switch here. This is our on and off switch. As well as that, it allows you to adjust the intensity of the stimulation that you're applying. So if you find that it's too intense, you can actually roll it back some. And if it's not enough, you can roll it up a little bit more. And up from there is a little black button that is a timed treatment button. So when the unit is on and you push this button, it will put the unit into a hands-free mode that allows you to continue to treat, even though you're not holding down this black button. And that's really useful when you're doing things like doing vagus nerve stimulation, so you don't have to hold that button down the entire time. So we're going to turn the unit on, and you're going to hear a beeping sound, like a tone. If I flip the unit over, you're going to notice there's a nice green light there. If you turn the unit on and there is not a green light, so if it looks like, let's see if I can find a battery to show you what happens here. I think I've got a battery here that's not that great. Here we go. So if you turn the Dolphin Neurostim on, so here it's off. If I turn it on and I do not see a green light, that means I need to change the battery. So now is a good time to go over how to change the battery. And I'm going to point out to you guys that there are two screws in either end of this unit. Please, whatever you do not take those screws out. One of the biggest things we have to do in terms of people returning this equipment is they try to change the battery by taking these screws out. And when you do that, two things happen. Number one, it voids your warranty. And number two, stuff goes everywhere and has to get sent back to us so we can put it back together for you. So you will notice that there is conveniently placed a little battery compartment right here. And if you take that open and don't take the screws out, things work much better. So you can use anything from a screwdriver to a coin to pop this open. So I'm going to use a quarter here and just pop this compartment open. You'll see there's a 9-volt battery in there. It is a tight fit, so you're going to wrap it on your hand. That's going to allow you to pull it out. You'll notice that we put Panasonic batteries in these stock. There are 3 types of batteries we recommend for this unit. We do recommend Panasonic batteries. We recommend Energizers and Duracells. Beyond that, we really don't make any recommendations because, believe it or not all 9-volt batteries are the same size. So AA batteries, single A batteries, AAA batteries, D batteries, C batteries, all those are the same size, but 9-volt batteries, some are a little bit longer than others. And if you get a battery that's too short and you put it in here, it's going to rattle around a little bit and you're going to get intermittent contacts and you're not going to be able to do a good treatment. If you get a battery that's too long and you put it in here, you're actually going to jam it against the post in here and you can actually break something. And if you use cheap, like dollar store batteries in this, they have a really bad habit of dumping all their voltage at once. And so you can actually damage the circuit board in here. So please do buy decent batteries. A normal alkaline battery like this will last me almost a month. I use these in my practice. I start at 8 o'clock in the morning. I finish at 6 o'clock at night. I work straight through, and probably about 20 to 30 minutes of each treatment is a microcurrent treatment with the Dolphin Neurostim, and these last me about a month. So you shouldn't have to make too many battery changes during the month if you are treating yourself. So if you will get a battery or replacement battery of some kind, in this case, I'm going to put a Duracell battery in here. You notice that there's no cord or cable sticking out of here. It's a fitted compartment so that there's no cable that will snap. So slide your Duracell battery in, and you're going to notice when you put this back on, it's going to be really hard to put on. So when you push it, it's going to snap, and you're going to think it's broken, but it's not. It's just a tight fit. So when we turn the Dolphin Neurostim on, you should see a nice green light here, and hear a steady constant tone. So as long as you've got that, you know you're good. So once that is on, you can hold this button down, and you'll notice that the light flashes on the other side. If I take my finger off the button, the light stops. So when we turn this device on, it's in what we call the search mode, which allows us to find treatment points, which are acupuncture points, myofascial trigger points, and motor points. So that this will find all those for you, and I'm going to show you how to do that in just a minute. But we've got a couple more features to go over. So unit's on, light's green, so we know it's good. So I can hold this button down, and we know we're getting a good treatment. Or I can push this button right here, and you'll notice that the unit goes silent. And when I turn it over, you can see the light is flashing right here. So it's in our constant treatment mode. So it'll continue to stay on for anywhere from 11 to about 14 minutes. So what it does is count the number of electrons going through the tip, so it knows when to turn off. We didn't used to have this feature, and what would happen is people would put vagus nerve stimulation on at bedtime, then they would fall asleep, and they would leave the unit on all night long and do vagus nerve stimulation for hours, and it just runs your battery out. So we put this feature on here so that people would not do hours and hours of vagus nerve stimulation when they only needed about 30 minutes, and so it saves your battery. So it counts the number of electrons going through there. When it hits a certain amount, it turns itself off. So what that means is if you've got like a nice fresh battery, it's going to go a little bit less time. If you have an older battery that's not running quite as well, it's going to go a little bit longer. So like I said, the time varies anywhere from about 11 to 14 minutes, but it'll turn off for you so you know when. So when it turns off, it's going to revert back to having a nice green light there, and you have a good tone. Moving on the back of the unit, you will see there are a couple of slider switches here. One of these says polarity, and the other says skin type. So the polarity switch allows you to choose, this is direct current, and this allows you to choose the polarity of it. So we have a negative polarity, which is what you're going to do most of the time. We have a positive polarity, which is what you're going to do very infrequently. And then we have a biphasic channel on here that's going to be very useful when you get to treating scars. So how do you know which one of these settings to treat? Well, if you look in the books that come with the equipment, let's see if I can grab a manual here. I have a vagus nerve manual here, but there are other manuals that come with the device. When you look at any of the points listed on here, you will see a minus or a plus listed next to those. So for any of the protocols we have, let's see if I can find another protocol book here. Let's see. I've got a lot of them here, so let's see what we've got. Here's one on veterinary acupuncture for horses. So we're going to open that up, and we're going to look at lameness. And you'll notice, again, by each of the points, there's either plus or minus. So that corresponds with the polarity on the unit. So you simply look at the instructions in your book and set the polarity on here, and you're good to go. So the negative polarity is good for bringing things down. So that's for conditions of excess, which is most of the things you're going to treat. So conditions of excess are things that are too much. So that would be things like a headache, because nobody wants a headache, muscles that are too tight, trigger points that are referring pain somewhere. Heart attacks would be something like that. A seizure would be something like that. An asthma attack, any kind of pain. Basically, most of the things you're going to treat are conditions of excess. So if you left this on the negative setting, that would be where it needs to be like 99% of the time. However, sometimes you want to bring things up a little bit. So you would slide it to the positive setting. So that's tonifying in acupuncture. So negative is sedating, positive is tonifying. If you're going to bring things up, conditions you might want to use that for would be things like Bell's palsy, where somebody's face was drooping on one side, and you need to put energy into that area to bring things up. Sometimes with post-stroke patients, when you're trying to rehab an area and get more energy into an area, it's useful for that. Also, when you're doing things like an acupuncture facelift and trying to tone muscles in the face to bring things up, it's useful there. It's also useful for things like fertility treatments. That's a good one for that. And sometimes it's useful for urinary incontinence treatments as well. So anyway, there are some times when we use the positive setting versus a negative setting. And then we have this biphasic setting over here that's got this plus minus on it. And you're going to use that a lot when you treat scars. So below that, there's another slider switch that says skin type. So this unit has an ohmmeter in it. It measures how conductive your skin is by testing it with the tip. And that will allow you to find treatment points. But you have to realize that sometimes people have very wet skin. Sometimes people have very dry skin. I live down in Georgia in the States. It's very humid down here. So this time of year, a lot of people come in, they're kind of sweaty. And that's salt water, which is very, very conductive. So I need to put this on the wet setting because their skin is very moist, so that I don't find acupuncture points where there aren't acupuncture points, because this is going to measure how conductive the skin is. And the sweatier it is, the more conductive it's going to become. Now, if I were in Canada in the wintertime in Alberta or somewhere like that where it's really cold, people are going to have very dry skin. So you want to slide over to the dry setting, which is going to make the tip of this more sensitive to finding treatment points. So that's how you use that. If you find that that you don't seem to be able to find points well, you can just make it more sensitive by sliding it over to the dry setting. And you'll notice there is a big stainless steel little plate right here. And it is very important whenever you are looking for acupuncture points, trigger points, or motor points, that you actually touch this plate. You have to touch this plate or you're not going to be able to A, find points, or B, do treatments, because electricity has to go into your patient and it's got to come back out. Even if you're treating yourself, it's got to come back out and go through your hand into this little metal plate right here to complete the circuit. Otherwise, you're not doing a full treatment. You're actually just doing acupressure. So you have to complete the circuit for this to work. It's an electrotherapy. So it's got to go in someplace and come back out and reconnect with the unit. Okay, so we've gone over the little features here. When you hold these devices, I do recommend that you hold them like you're holding a pen. So if you put your thumb on this metal plate right here, drop the unit over like this, it just rests nicely in your hand. That allows you to drop your hand down on whoever you're treating, be it yourself or someone else. And then you can use the heel of your hand as a fulcrum and you move this around gently to find acupuncture points. It is important that you go slowly when you're trying to locate points. So I'm going to look in this little vagus nerve book here, and we're going to find a couple of points that you guys can follow me with, and I'm going to teach you how to find treatment points. So let's see here. Let's look on page, gosh, I guess I need my glasses to see that. If you look on page 12, it says general recovery points. So there are 2 points right here. There's one on the hand called large intestine 4, and there's another right over here by the crease of the elbow called large intestine 11. That's what the LI stands for. So you'll notice then in all of these, there are going to be little initials by each of these. Each of those initials corresponds to a meridian in acupuncture. Meridians are the energy lines in acupuncture. So you've got all these energy lines that run through your body. They're named after body organs. You've got the lung, pericardium, heart, liver, spleen, kidneys, large intestines, small intestines, gallbladder, things like that. Half of them are male and half of them are female. So just a little lesson for you guys. Any meridians that are on the front of the body, which is the soft part of the body, these are female meridians. They are ones that are always working and vital for life. So that's things like your heart, your liver, your lungs. Ones that are on the hard parts of your body, like your back and outsides of your legs and arms. So insides would be female, outside would be male. Those are organs like your large intestines, your stomach, your small intestines, your bladder, things that, according to one of the acupuncture manuals, they are like a man, hollow, superficial, they tend to fill up and empty, and you can live without them. So that tells you how important men are in the world of acupuncture. So anyway, half are male, half are female. The female points are nurturing, so they are for healing type things. So if you're trying to get someone better from some kind of disease, you're usually going to use female points. If you're trying to accomplish something like fix a frozen shoulder, increase range of motion in the neck, something like that, those are male points. Those are kind of like warrior points. Guys run out and fight and stuff like that. So that's kind of how they look at those points. So if you're trying to heal from something, you use female points. If you're trying to go, make something happen with a muscle group, the male points tend to be a little bit better. Okay. So how do we go about finding points? I'm going to move this back a little bit and bring this down.
What the hell?
You don't have audio while you're explaining.
Hey, Joe, we can't hear you.
We're not able to hear you.
All right. Can you guys thumbs up? Can you hear me? All right. Good deal,
Yeah.
guys.
Can you hear us?
All right. Yeah, I can hear you guys. We're just having some, I don't know if there's the internet's glitchy over here or something. There's a thunderstorm in the area, so that may be interrupting things a little bit. All right. So moving right along, we have large intestine 4 here. We're going to find that by looking for the light to go out and the pitch to go up. Of the two, the most important of the two is to listen to the tone of the unit. Sometimes the light will not go out over points. If it's really, really dry skin, sometimes we actually have to wet the skin a little bit and dry it off to make sure we can find points. So the other point we're going to look for is a point called large intestine 11. Right here, it's in the crease of the elbow. This is a really good point for things that require homeostasis, so bringing the body back to normal. I used to use it a lot when my kids were younger. It was a good point for treating fevers. That's one of the ways I liked it. If I'm treating any kind of disorders that are, there's a lack of homeostasis in the body, like things are very excessive, I'm trying to level things out, this is a good point for that. So to find large intestine 11, I'm going to take my arm and bring it up, and I'm going to look for this crease in my elbow right here. I'm going to go to the end of this crease. So I'm going to mark a little dot right here so you guys can see it. So there's our dot right there. Let me pull this down a little bit so you can see. All right. And again, we are going to turn the Dolphin Neurostim on, check and make sure we got a good green light so the battery's good. Make sure our thumb is on this. I don't recommend trying to find points with your fingers on that plate. I'm going to do it just so I can show you, but I do recommend holding the device so it rests in your hand like this. All right. So I'm going to pull this across the skin here. One of the big mistakes people will make is that they will move this too quickly. If you move this too quickly, you'll go right over the point and never realize you even hit it. So you need to go slowly. You can see right as I get over the point, the light goes out, the pitch goes up. So there's our number 2 acupuncture point right there. So when you first start doing this, there is a little bit of a learning curve. It takes probably a day or two of playing with this a little bit to consistently find treatment points. But other than that, you really shouldn't have too many difficulties. If you do, you can always post on our Facebook forum if you have any questions about it, and we can help you guys out. I can tell you that one of the big mistakes that people make when they're doing this is that they push too hard. So I'm going to go ahead and head that off for you guys and show you what happens. So there's not really an acupuncture point right here. So I'm going to take this device, turn it on, and I'm going to put it so you can see it. So notice the light is still on, but if I push really hard, you see how the light goes off? So I'm going to stab this around a little bit, and you'll notice that wherever I stab it down really hard, the light goes off. All of those are not treatment points. Those are just areas where I've pushed really, really hard. And if you push really hard, you compress the skin. When you compress the skin, it becomes more conductive to electricity. So it is important to use better than super light pressure when you do this. But if you push really hard, you're going to get a lot of false positives. So you're going to find points where there aren't acupuncture points. And each of those acupuncture points has a specific job. You know, if you want to release a frozen shoulder for whatever reason, the point's somewhere down on your shin. If you want to stop an asthma attack, the point's right here on the corner of your thumb. So all acupuncture points don't have the same job. So it is important to choose the right points because your outcomes are better. So that's the general tutorial on how to find treatment points. And if you have any more questions on that, we can review that at the end. But right now we need to move on to the second part of this tutorial, which is how to treat scars. This is one of my favorite things to do. I'm actually teaching a workshop this weekend down in Vero Beach, Florida on scar release therapy. I do a lot of that in my practice. So I have worked in neurosurgery offices. I've worked in women's health offices, and I've worked in spine rehab clinics. And through the course of all that, I've ended up treating a lot of scars for a lot of different problems. So some of these people are people who've had past surgeries. Some of these are people who have currently had surgeries, and a lot of different institutions use this, in hospitals use this in their PT rehab departments for like post knee replacement, post hip replacement. We do a lot of workshops for the military. The military makes a lot of scars, so they like to get those things treated. So how do we go about treating scars, and why is it useful to treat a scar? Well, I'm a manual therapist. I've been a manual therapist for, gosh, almost 30 years now. And I have seen just about everything there is to treat scars, from injections to ultrasound to scraping techniques to manual therapy techniques to energy techniques, all different kinds of things. And I can tell you that you would be hard pressed to find anything that can release a scar as quickly as this does. Scars have very odd electrochemical properties. And the best way to manipulate those properties is by using electricity, specifically direct current electricity in the microcurrent range, which this does. So if you can do that, you can actually repolarize the tissue. And when you do that, it changes the density of it. So we've done scientific studies on this. We've looked at diagnostic ultrasound. We've taken before and after pictures on a number of patients. So we know that properly done, you'll get about a 20% reduction in the overall density of a scar. The exact measurement is the cicatrix gray mean density, which is just a fancy way of saying how dense a scar is. But a properly done treatment will average about a 20% reduction in the density. So what that does is it improves the mobility of the scar. You get more plasticity in the scar, so joints move better afterwards. A lot of things get adhesed after you have surgery or even after you get injured. Things that also count as scars beyond surgery are things like broken bones, because you can get scar tissue around the periosteum of the bone, chronically sprained ankles, any kind of abdominal tearing, like after pregnancies. A lot of people end up with abdominal adhesions, even if they've never even had a C-section or hysterectomy. So it's a very useful thing to do, and it's very quick. Scar tissue will block the flow of lymph, so you can get a lot of swelling in limbs after surgeries or traumas. It will interrupt your autonomic nervous system, so it actually acts as an agonist to the autonomic nervous system and drive sympathetic nervous system activity. So old scars can wind up your nervous system electrically and make new injuries hurt more. So a lot of times we've actually done studies where we've treated old scars for new injuries, and we find that very old scars, if you treat them when somebody has a current injury, it reduces the overall pain of that current injury because of how the scar affects the autonomic nervous system. So once you repolarize that tissue, it stops being an antagonist, or I guess an agonist, of the sympathetic nervous system. So scars will actually wind up your fight or flight response and can actually trigger things like anxiety attacks. It's a little strange, but it's just how it works. Also, scars, any scars that cross any of these meridians in acupuncture are considered to block energy, and that's always bad. And where else? Scars will entrap nerves. So we see nerve entrapments from scars, and those can be quite painful. My expectation is when I treat a scar, most of my patients should feel at least 50% better after one scar treatment. But typically it's anywhere from 70 to 80% relief with treating a scar for the first treatment. So it's really fast. Hey guys, somebody has their audio on. If you could hit the mute button, that would be great.
Okay,
Thank you.
you're having a good time.
All right, let's see here.
Well, you just sent.
All right. There we go. I think we got it. All right. So how do we go about treating a scar? Well, if you're going to treat a scar, you need 2 Dolphin Neurostims. Okay. So scars don't conduct electricity well, so you have to be able to force electrons through and across the scar. And the only way to do that is to have 2 separate power sources. If you try to treat a scar with 1 Dolphin Neurostim, it just doesn't work very well. We've tried it in the past. It's pretty ineffective. It's better than using a sharp stick, but it's way, way better if you use 2 of these, because you actually get some serious releases on these scars. I'm going to show you how to do that. And to do that, I'm actually going to draw a scar on a piece of paper here. We're going to pretend like I have had open heart surgery. And by the way, you can use these over any kind of plates, screws, stitches, whatever. You can start doing this immediately after surgery. Obviously, you don't want to stick the tip of this into an incision of some kind, because, you know, I like to use what's called the rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. So don't jam it into an open wound. Don't shove it up your nose. Don't shove it way down your ear. And other than that, you're pretty well good. All right. So I've almost got my little illustration done here. So one of the things that I have seen a lot of over the years is people who come in with neck and upper back pain from having open heart surgery, severe neck and upper back pain, because it pulls really, really hard on all that tissue and actually pulls around to the back. So we're going to show you guys how to do this here. All right, so this is going to be my open heart surgery scar. We're going to tape this on my shirt like this. Let me get a couple more pieces of tape to make sure this thing sticks where it should. Not bouncing all over the place. Okay, so here is our open heart surgery scar. Got a zipper straight down the chest. I'm going to take one Dolphin Neurostim and I'm going to put it on the negative polarity. So I'm going to slide over the minus sign and I'm going to put it on the dry setting. I'm not really looking for acupuncture points with this, so I don't really need the light to go off. And the second one, I'm going to slide it over to the dry setting, and then I'm going to slide the selector switch on the polarity over to biphasic. So that's a plus minus symbol. It doesn't matter which side you hold this on. What you're going to do is turn the Dolphin Neurostims on. Again, check, we make sure we got some green lights here. And we're going to put this on either side of the scar and hold it down. And we're going to count 10 beeps. You're going to go just off the border of the scar. After 10 beeps, you're going to pick it up and move down about 1/4 of an inch and do the same thing. So you're going to do this all the way down the scar, 10 beeps each time until you get to the end of the scar. When you get to the end of the scar, you are going to take the Dolphin Neurostims and you're going to switch them from one hand to the other. So what I've done now is I've switched the, you could switch the little polarity switches here, but it's easier just to switch it from one hand to the other. And we're going to start at the bottom of the scar. We're going to work our way back up. So we're going to count 10 beeps each time, working all the way up the scar until we've gone to the top. So that's 2 passes. I'm going to switch them again. And I'm going to do, again, starting at the top, counting 10 beeps. I'm going to go all the way down the scar doing that, moving in 1/4 inch increments. So what we're trying to do here is, because the scar itself is not very conductive to electricity, we need to pass electrons back and forth through this scar. So essentially what we're doing is playing a game of ping pong with electrons. We're going to push from one side, we're going to pull them to the other side, and we're going to pick them up and we're going to throw them back over. So it ends up kind of doing this kind of thing. You end up with this kind of swirling of electrons through the tissue. The more electrons you pass back and forth through there, the better off it is. This is not a game of treating acupuncture points. This is a game of repolarizing this tissue. So the more time you spend, the better it's going to be. But for a basic scar treatment, we do recommend 3 passes with 10 beeps at each point. So that's going to be a total of 30 beeps over each point. If you have more time, definitely do spend more time. But this is kind of the bare minimum of what you want to do. And once you've done that part of it, we do recommend that you take each of the Dolphin Neurostims and you start at either end of the scar. So now what we've done is we've repolarized some of this tissue and we've increased its ability to conduct electrons. So that allows us to now push stuff straight through the scar. So now we're going to go on top of the scar. So previously, if we had taken, let's say like a normal TENS unit and taken a TENS unit pad and put it on top of the scar, and just thought we could do it that way, what happens is the electrons don't actually go through the scar tissue, they just go around it. So electricity takes a path of least resistance. So scars have very high resistance to electricity. So it just goes around it and it doesn't really release a scar. So using pads is not the way you're going to release a scar. You actually have to have like 2 very concentrated areas of current. They have to be 2 separate sources. You have to be able to push and pull back and forth through it. But once you have it conducting a little bit, then you can take your Dolphin Neurostim, which you can start at either end of the scar. And you can just push right on through the scar. So now I'm just going to work through the scar. I'm not looking for acupuncture points, so I don't want the light to go out. I'm not paying attention to the light. All I'm doing is putting it down. So I'm going to go 10 beeps and move 1/4 inch. That's 1 pass, 2 passes, and I'm going to do a 3rd pass just like that. And after 3 passes of that, so we've gone back and forth through the scar. Now we've gone on top of the scar to drive electrons straight down through it and pull them up through the scar tissue itself. You have a scar that's reasonably well repolarized. And if you do that, if you are conscientious about it, and you do this carefully, you'll see some really amazing results on a single treatment. It is very, very common to see visible changes in the scar on the first treatment. And it is also very, very common to get really nice outcomes very quickly. What if you have a scar that looks like this? So this would be like a burn scar, which I have some right here. I actually burned myself with kitchen grease the other day. That was a lot of fun. So I spent some time working on those myself. Since they're fresh, I want to, when you use microcurrent in the frequency range and pulse width range that this is in, it actually increases ATP production by 400 or 500%. ATP is adenosine triphosphate. So it actually speeds up the healing process. This is just a few days old, and I've already got nice pink skin underneath. So it's a good thing to do. And these are very fresh. All right, so if you have an old burn scar like this, you simply work around the scar clockwise or counterclockwise. You start on either side of the scar and you just work around it. Okay, so you're just still doing the same thing. You're passing electrons back and forth through it, and then you're going to go through the scar itself to force electrons through the scar. And it's definitely more time consuming to do a big scar like this because it's a lot of surface area, but your outcomes will be just as good. It just takes a little more time. I used to work in a pain management practice with a neurologist, and we had a lot of people coming from some of the local mills around here. They make a lot of paper, and these guys get steam burns, and steam has an awful lot of energy, way more than normal hot water, and the burns tend to be pretty severe. So I've treated a lot of steam burns over the years. They do respond quite well to microcurrent. Interestingly, it doesn't really matter if it's an older scar or newer scar. Sometimes older scars are even easier because if you have a scar that's 50 or 60 years old, like it's set, like it's not going through any tissue remodeling. It's just kind of done what it's going to do. So when you treat it, whatever change you make in it, it's going to be almost instantaneous, and it'll last for long, long periods of time. If you have a very fresh injury like these, if there's any scar tissue involved with it, hopefully I will reduce the amount of scar tissue that comes into play with that, and speed up the healing process. But I have to understand that there is going to be tissue remodeling that happens there. And so it's going to continue to change over the period of a year or 2 years. It actually takes a while for all that to happen. So I'm going to go back periodically and retreat it. But once the scar is set, whatever change you make in that scar is done. So unless you re-injure that tissue and create more scar tissue in that area, if you release a scar by 20%, it is 20% released from here on out. If you release a scar by 100%, it is released 100% from here on out. So people often ask me, like, what do we charge for that? So our fee for that is $150 for release, for doing scar tissue release. That's the initial treatment, which takes about an hour. This is on average, like surgical scars. And then follow-up treatments are about $90 per half hour. It typically takes about a half hour. I do market a lot to plastic surgeons, not because they make ugly scars, but even plastic surgery scars can be very, very painful. Even though they look great, they can be painful and they can be numb. So facial, like facelift scars and like breast augmentation scars and things like that, they may be thin, tiny little scars, but they can still be quite painful. And they can still have numbness with them because the scar tissue will actually wrap around the nerves and numb things out. And if we treat them, we can cut the pain and bring sensation back. Now, obviously, we also treat a lot of other scars. We get guys, we have a program here, which I'm actually wearing one of the t-shirts right now. We have a nonprofit here called Heroes for Health. We treat a lot of veterans. We have some money set aside for those guys. So guys who have, amputations, who have legs blown off and stuff, we do treat these scars too. That actually works pretty well for phantom limb pain. So that's something to keep in mind. So anyway, that's a general rundown on treating scars. Doesn't really matter where the scar is. You can treat scars in your scalp. You can treat them on your feet. You can even treat scars like if you've had like dental work done and they have to cut down into the gums. You can treat from the outside, or you can use, let's see if I've got one here. There's an extension probe that comes with the equipment that looks like this. And you can take that out and put it on the end of the Dolphin Neurostim like this. It's flexible, so you can bend it to whatever shape you need. It's supposed to be for self-treatment. So you could tape this to a back scratcher and treat points on your back if you needed to, if nobody else could do it for you. But we find these useful for treating scars inside the mouth. And I worked in women's health. We would actually make the patient buy these. They're about $25 a piece. We would use them for releasing things like episiotomy scars, where you don't want to stick this on an episiotomy scar. So we make the patients buy these, and then we would clean them they would go take them home, clean them, and bring them back for their next treatment. So anyway, highly effective modality for treating scars. You will be hard pressed to find anything that works as well. Even some of the neural therapy injections don't work as well. So a great thing. I love treating scars. It's one of those things where you get great outcomes almost every single time. Okay, so we've gone over how to hold the unit, how to find points, how to treat scars. So now we need to work on how we go about doing vagus nerve stimulation. So if you have a vagus nerve stimulation kit, there should be some different things in your kit, and I will show you some of the things and how to set this up. There should be a black cord like this. There should be some ear clips like this. They come in two varieties. There are white ones and black ones. If you look at the clips carefully, you will see that the white clips have a little conductive rubber on them right here. You do have to moisten that for it to work. So you need to put something conductive on here, salty water or something. If you have the black ones and you look at the black ones, you will notice that they have shiny metal on them. These are going to be a little more conductive out of the gate, but we do still recommend that you put some kind of conductive medium on there. Actually, hand sanitizer works pretty well on these. It sanitizes it and it makes it more conductive. If you have sensitive skin, we do recommend that you use these ones with conductive rubber. Even if you don't have sensitive skin, we do recommend that you put something conductive on there so that it doesn't pick one tiny little point of your ear and pour all the electricity through that, because it tends to irritate the skin, and we don't want to do that. So the other things you should have are a splitter cable, what we call a Y wire, that looks like this. That's going to come in handy. And there's also going to be a white cord that looks like this. And you're going to find some electrodes. Some of them are oval electrodes like this. And there should be some square electrodes that look like this. So here's how we're going to set the whole thing up. We're going to take the Dolphin Neurostim. We're going to take this black cord. You'll notice that there is a shiny little plate in here. That plate has to touch up against the metal tip of the device. We're going to slide this on there like that. I'm realizing this dark shirt is not the best thing to wear when I'm doing these. You guys can't see when stuff gets against my shirt. All right. So fits on like this. And now you have a male connector at the end like this. And you're going to take your Y wire and put it on there like this. So you have two male connectors like this. You're going to slide one of your ear clips on one of the male connectors, one of your ear clips on the other male connector. And this part is all set up. You're then going to clean this metal plate right here with an alcohol wipe. And we do recommend that you clean them carefully, because if you do that, it will make sure that there's no oil from your skin on there. And then when you use these little oval electrodes, they stick much better and you can reuse them. So take one of these, slide it on here. You're going to go and connect it to your Dolphin Neurostim like this. So now I have a nice little oval electrode there. And then on this end, you'll notice it looks like a female connector, but it is indeed a male connector. If you look inside, there's a little tip that sticks out right there. So don't get confused by that. If you pull out your rectangular electrodes, you should have a pack of 2x2 electrodes like this, and slide this on. Now, there are two places where we recommend you put these pads. There is a little vagal stim grounding applications that comes with it. You will see that we recommend putting this on your left wrist or below your belly button, about 4 fingers below your belly button. So either one tends to work pretty well. If you're going to be using the Y wire, the split cable, we do recommend grounding this on the left wrist. So again, you want to make sure you clean this area well with alcohol to take the oil off so this electrode sticks better. You're going to take it and you're just going to slap it right across your wrist like this. Then you're going to take these ear clips And you'll notice on the other side of this, there is an ear clip placement guide. So there are 3 locations where we recommend putting the ear clips. And in order of the best places to put them, I will go through it with this nice little ear we have here. So the best place to put it is on the tragus of the ear, which is this flappy little thing right here. So the tragus of the ear, the inside of the tragus, so if I stick my finger right in there, the inside of the tragus has the highest concentration of nerve endings from the vagus nerve. So that'd be the best place to put it. The problem with that is most people have a tiny little tragus. When you put these clips on, they tend to pop off. We are working on that. We're trying to get some that have a different texture on that will stick a little bit better, but it's turning to be, it seems like a simple thing, but it's turning out to be a little more of a challenge than we expected. But if you're blessed with big flappy traguses, you can put these right on the tragus and you're good to go. If it does not fit on the tragus, the next best place that has the highest concentration of nerve endings from the vagus nerve is in the upper concha of the ear. So you've got this little kind of little cave right here, this little right up in here. So right up in here is the upper concha. So you're going to take this and you're going to put it from the bottom. You're going to take the conductive part and put it up in there. And you'll squeeze it down to make sure you've got a good connection there. So that's the other place. And your default location is going to be on the earlobe itself. Okay. So since I have the Y wire connected here, I'm just going to put it on my earlobe so you can see how that works. So I've got a clip on either ear. I've got a pad on my wrist. So the electricity is going to go into these and it's going to come out through this. When we're using the dual connector, we're going to slide this to the biphasic setting right here. And we're going to turn the Dolphin Neurostim on. When we turn it on, we should not see a green light because we have a good connection. And I'm going to push this constant treat button right here. And the unit's going to go silent. And sometimes, but not always, but sometimes when you turn it over, you will see the light flashing. Don't pay any attention to that. There are exactly 2 times when you want to look at the light on this device. The first of which is to check and make sure you've got a good battery. The second is to make sure you found a treatment point. Other than that, don't look at the light. It will just confuse you, and it does not mean anything beyond those 2 things. So if you start trying to figure out what the different flashes of light mean and how bright it is and it doesn't connect to anything. Don't waste your time. It's a rabbit hole that'll just lead you down to nothing. All right. So this will stay on for anywhere from 11 to about 14 minutes. And once the cycle is done, I'll hear a nice steady pitch like this. So it'll just make a steady noise. And that's my cue to either turn the device off, or I can push this button again and cycle it again. And that's all there is to it, guys. It's pretty easy. Now, some people don't respond as well to 2 ear clips. Some people might want to use 1 ear clip. If you're going to use 1 ear clip, we do recommend using the left ear and the left wrist. But you can also put it left ear to below your tummy. The only time you're going to use the right ear by itself is when you put this on the positive setting. Okay? You're going to put it on the positive setting. You're going to let it run for maybe 5 minutes. And typically the only time we do that is when we're trying to bring things back up a little bit. So here's the deal with the vagus nerve. The vagus nerve is the longest nerve in the body. It's called the wandering nerve. It starts kind of behind your ears here, inside your head, and runs kind of down the sides of your neck, comes together here and goes down to your gut. Is the information superhighway between your brain and your gut. More information actually goes from your gut to your brain than goes from your brain to your gut. When you put this on the left ear with a negative setting, it tends to bring things down. So it will drop your cortisol levels. It will increase your HRV, which is your heart rate variability. That's not the same thing as your heart rate. If you Google HRV, you can go down a whole rabbit hole on how heart rate variability ties into your health. What you need to know is the higher your heart rate variability is, the healthier you are, the better your immune system is, the better able you are to respond to stressors like an injury. The other thing it does is increase your high frequency vagal tone, which is a measure of how well you actually heal from things. So once you're sick, like how well you heal from that. Once you're injured, how quickly you heal from that. If, however, your system is way, way, way down, and you need to bring it up a little bit using positive polarity on the right ear. Going to the belly button is a good thing, like right below the belly button. So that'll bring things up a little bit. But we don't recommend that you do this before bedtime. It has a tendency to make people stay up at night. So if you're going to use a positive polarity, we recommend doing it either in the morning. Like, don't do any later than about 3 o'clock in the afternoon. Most people, there's no huge effect, but just to be on the safe side, so you don't have an unrestful evening, just do a little bit earlier in the day. So why do we want to do vagus nerve stimulation? Well, there have been a lot of studies done looking at numbers taken from EKGs. And if you do an EKG or ECG of the heart, there are a lot of, I guess, kind of equations you can apply to draw off information. And it gives you a lot of information about how healthy you are, about how likely you are to, say, die on the operating table if you have anesthesia and stuff like that, which is part of why we do stress tests. So we look at things like heart rate variability, determine how well you're going to do if we put you under anesthesia. And if those numbers aren't good enough, they're not going to put you to sleep because there's a chance you might not wake up again. So it's a very important number. And these are numbers that you can use that can be manipulated with this device. So this can actually act as a neuromodulator. The nice thing is it's going to push your body in the right direction. If your body doesn't need it, it's really not going to take the energy. That being said, we don't recommend your first treatment doing this for an hour or two. We recommend doing 5 minutes on your first treatment. So here in the clinic, if we're going to have patients take these home or even do a first treatment in the clinic, we do this for 5 minutes. And we see how our patients react. Most people don't even notice a difference, but every once in a while you get somebody who has a super sensitive nervous system. Maybe they've got dysautonomia or something like that. And in those particular cases, you want to check and see how they respond because they might be much more responsive. So then we recommend adding about 5 minutes a day until you hit between 20 and 30 minutes for your treatment. And that's usually good for most treatments. So the next question I get is, how often do we do these treatments? Well, let's see. I'm 53 years old. My general workday starts at 8. I finish at 6. So I do 10-hour days. I raise 2 kids by myself. So I leave here, then I go home and feed my kids and do all that. So, and then I run around teaching these workshops in different places around the country. So my life is not particularly stressful, but it's hectic in that I'm just going all the time. And I'm not 20 anymore. So I tend to get kind of tired towards the middle of the week. So I find that if I do vagus nerve stimulation about twice a week for about 30 minutes, it puts me in a really good place, keeps me from getting so exhausted in the middle of the day, and really gives me the energy to kind of carry on. When I had COVID and I had the Delta variant, my oxygen saturations was hanging out around probably 92 or so. So I was sick, but not that sick. But then I got really, really sick because I didn't take the herbs I was supposed to take. I had all this stuff lined up that I was going to do when I got sick. And I did it for the first probably 4 days. And I was in a pretty good place. And then I decided I didn't need to do that. And when I didn't do that, I got very, very sick. And so my oxygen saturation dropped from 92 down to about 80. And I was quite ill. I was facing having to go in the hospital, which I did not want to do because I didn't want to leave my children home alone with nobody to watch them. So I started doing vagus nerve stimulation. And after a couple of hours of vagus nerve stimulation, I was actually able to get my oxygen saturation back up to around 90 or so. So I really did save myself a trip and a stay in the hospital. It works quite well for recovering from athletic events. We have a lot of professional level athletes who use this. In high level athletics, you typically have usually, like if you're like a distance runner and you're going to be running a marathon, there's a certain date you're going to peak on. So you start your training so that you peak on that date. But if you overtrain yourself, you go into what's called OTS, which is overtraining syndrome, and your heart rate variability tanks. No matter how much you train, you don't really get faster. You don't really get stronger until your body recovers this heart rate variability. And so that's usually a period of about 3 days. And if that happens, say 5 or 6 times during your training regimen, you don't peak on the right date. But if you do vagus nerve stimulation, you can do this immediately after your workout. And it does a really good job of keeping things where they're supposed to be. Drops your cortisol down, reset your system so that you can keep training. So anyway, it's a very useful tool for recovery from surgeries. It's a useful tool for recovering from injuries. And for people who have chronic inflammatory processes like autoimmune disorders, things like Crohn's disease, this is a really good tool for dealing with that. And it works pretty well for neurological disorders too. We have some interesting cases with Parkinson's disease, people who respond quite well to vagus nerve stimulation. So if you have any type of autoimmune or chronic stuff, you might give this a try and see how it does for you. Most people find a positive outcome with it. But just go about it slowly. Don't overdo it. Build it up slowly over time. And I think you'll find that you will be quite pleased with the outcomes. So that's the basics for how to do vagus nerve stimulation. Before I forget, we do need to go over some contraindications for this. So like I said earlier, I like the rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. Don't jam it up your nose. Don't stick it in your eye, things like that. It is perfectly fine to use this to treat around an open wound, but not in an open wound. So you don't want to stick this in an open wound. But if you're going to treat around it, it does increase ATP production and helps it heal up much faster. It's perfectly fine to use this over plates, screws, dorsal column spine stimulators, baclofen pumps, insulin pumps. All those are fine. That's not a problem. The one thing I will say is if you are treating yourself or someone else who has a pacemaker or a defibrillator, you should check with the physician first. If they say it's okay, I guess you're good to go. But I'm not a physician, so I'm not going to tell people to do this when they have those things. My father has a defibrillator. I've treated him before, and I don't want to kill my father. And I found that it was okay, but I checked with his doctor first. So, but just because I do it doesn't mean you shouldn't check with your doctor or your patient's doctor first. It's always a good idea. All right. So pacemakers and defibrillators can be a contraindication. Pregnancy, especially during the first trimester, can be a contraindication for this. Check with the OBGYN first. If they okay it, you do not want to treat over a gravid uterus, meaning do not stick this on the front of a tummy over where the baby is. That's a bad idea. Avoid acupuncture points that push energy down. That's things like large intestine 4. Any points on top of the shoulders push energy down. Points on top of the head push energy down. Spleen 6 around the ankles is used to induce labor. You should probably avoid that one too. And don't treat over the tummy. But once it's time to deliver a baby, this can be a useful tool for cutting the pain during delivery and for speeding up the delivery process. I used it when both my children were born. Other contraindications, if someone has active cancer, don't treat over an active cancerous tumor because there is the possibility, theoretically, that you could increase cell growth in an area of uncontrolled cell growth. It is worthy of note that there's actually a system on the market that is a microcurrent system that's FDA approved for treating brain tumors. So they actually use microcurrent for treating brain tumors. This does not have that FDA indication. But anyway, just for your knowledge. Other things you probably don't want to do with this. If you're going to treat small children, turn it on low. I treated both my kids when they were babies. We have done workshops for All Children's Hospital in Tampa, and they were using this on infants. It works quite well. Just turn it down on low and don't treat as long. It's fine to use on pets. It's fine to use. Don't stick it on top of your head if you have seizures. There's one acupuncture point on top of the head that's contraindicated if you have seizures. There are protocols for epilepsy, though. So there are protocols that help in acupuncture that do help bring epilepsy down a bit. So you might look those up if you know somebody who has that. And there are points that stop seizures. And twice now we have had occasion to stop seizures with these devices, and it has worked both times. So that's kind of nice to know. Let's see what else. I think that's about all the contraindications that I know of. Sometimes if people are on high doses of gabapentin, it does dampen the effect of these a little bit. Gabapentin interferes with your neurotransmitters, and one of the things that this does is modulate neurotransmitters in your brain. So that's probably why we see that. So that's all of our general contraindications, and we are at about 8:30 right now. So what I would like to do is take a look in the chat box and see what questions you guys might have. So let's see here. I have a client who has interstitial cystitis, overactive bladder. Is there any risk whatsoever the vagus nerve stim could make this worse? It's currently under control with Amitriptyline. I have used this a lot on people with interstitial cystitis, and it's usually pretty effective for helping them out quite a bit. People with interstitial cystitis often go to functional medicine doctors, and they get infusions of things like colloidal silver in their bladder that helps that out quite a bit. But the vagus nerve stimulation shouldn't interfere with that at all. Someone on a Facebook page said to do standard protocol. I could not find that protocol in the 2 books that I received. Can you tell us what the standard protocol is and when to use it? Standard protocol is something that we do for a lot of pain problems. It unfortunately is a 2-day in-person course to teach you everything you need to know for that protocol. But I can tell you that part of what it includes is when someone has pain, looking for the nerve roots that are involved. So if you look, let's see if I can find the dermatome chart here. Let's see what we got here. Oh, here we go. So part of standard protocol is looking to see where somebody's pain is. So if somebody had, say, let's say plantar fasciitis, okay? So plantar fasciitis is heel discomfort. We all know that just treating on the bottom of your foot doesn't really do a lot of good. If you go to physical therapists, they're going to tell you they're going to do a lot of manual therapy on your calf. They're going to tell you to stretch standing on the stair, so you stretch out the Achilles tendon. The problem is something has to perpetuate the contraction in this area. If we look at a dermatome chart like this, and you can buy these from the Dolphin Neurostim website, they should be on there. You'll see that the nerves that innervate this area are S1 and S2, so that's your sacrum right here. So if I go up and I treat over those particular nerve roots themselves, that affects the levels of acetylcholine down that pathway. Acetylcholine is a neurotransmitter that makes muscles not spasm but contract. As those muscles contract because of irritation up here, it makes this contract and it pulls on the Achilles tendon, which pulls on the bottom of the foot, and voila, you have your plantar fasciitis. So just treating the foot isn't enough. Just treating the calf isn't enough. You have to treat up along the nerves. Same thing goes for like elbow pain, like tennis elbow, carpal tunnel syndrome, any of those. You look at a nerve chart like this and you go to the spine, and there are some points on either side of the spine called the shoe points, and you treat those particular points. So that's sort of part of standard protocol and about as in-depth as we can go on here, because like I said, that's an entire class. How to release a tonsillectomy scar? Well, if you are trying to release a tonsillectomy scar, there are a couple things you can do. You do want to avoid pushing on the carotid artery itself. It's not the electricity, it's the actual manual pressure. Theoretically, that could cause someone to pass out. I've never seen it happen, but I don't go around poking on people's carotid arteries all day long either. So if I were treating a tonsillectomy scar, I would want to treat around the neck 360 degrees so that the current is bouncing back and forth through where the tonsillectomy scar is. So you want to make sure when you're doing this treatment, if these were a therapist's hands and they were treating me, when these touch down, they also have to touch my skin somewhere. Okay, that's very, very important. So if they wanted to treat on my neck and they put their hand on my shirt, that's not enough. There has to be skin-skin contact. Electrons have to go into the tip of this, come back up through the therapist's hand, and go into this little metal plate. So that's why it's important to touch the plate. So you have to touch the plate and have skin-to-skin contact with your patient. Now, if it's you are already touching this, so you don't have to like touch yourself and then touch the unit down. But if you're treating someone else, you do have to have skin-to-skin contact. And this only works if it's on skin. You can't put it on top of clothing. You can push the tip of this through clothing. You can make little tiny circles and try and push it through there. And I do that on occasion, but it does take some practice, and you have to know how to find your acupuncture points pretty well before you do that. For interstitial cystitis, I would look at this chart and see what innervates that area of the body, and I would actually treat over that. That's something that can be useful. Can you share how to release an episiotomy scar? Okay, episiotomy scars, you need, the way we used to do it in the OBGYN clinic, we would get 2 of the extension probes. Where did I put my extension probe? I know it's here somewhere. Here's one right here. So you need 2 Dolphin Neurostims. You need 2 extension probes. And so you're going to have your patient in stirrups. You are going to have 2 extension probes, 1 on each Dolphin Neurostim. One of 2 things needs to happen, because as a therapist, you're going to have 2 extension probes in your hands, so you can't hold these at the same time, okay? And you can't touch these. So your choices are, you can either have the patient hold the Dolphin Neurostim devices so they can turn them on. You can push the continuous treatment button so it's not making any noise, and they can hold them like this. And then you can use these to treat the episiotomy scar, just like a regular scar. Or you can have a nurse, in which case we always had a nurse present when we did these, and the nurse can actually hold these devices and touch the patient, and that's enough to do it as well. So that's the basic form of how to do that. I mean, it gets a lot more involved than that, but that's enough to get you started. All right, let's see what other questions we have here. There's something else we can do to help with an underachieving thyroid gland. There are actually protocols for things like different thyroid disorders. If you contact the Dolphin Neurostim people, they can probably help you out with that. It's a little complex, but part of what you would end up doing, certainly vagus nerve stimulation is an important part of that, because most thyroid things tend to be autoimmune. And so this does kind of put a damper on autoimmune type stuff. Let's see here. You would probably, points we've gone over, you would probably want to treat along the neck, because those are the nerves that innervate the thyroid. That's something you would end up doing. And you could actually probably use this large intestine 11 point we have in here. So any of the points in the like this fatigue for long haul recovery, this fatigue one is actually pretty good for bringing thyroid up a little bit as well. All right, how do you treat a DNC, or is treatment needed? If I were treating a DNC, I would treat the low back. So I would treat the nerves that innervate that area, and then I would treat directly over the abdomen. So I'm treating it over the abdomen as though there's a scar right there, and you're going to end up passing current through that area, and it's going to help it heal a little bit faster. I've been trying to find points on myself. I live in North Carolina, have dry skin. I have the setting on dry and have tried wiping my skin with water, just cannot find the high pitch. Any other tips? The other thing I would tell you is, not only should you moisten your skin, but make sure, there are 2 things. Make sure this is super clean, because if there's any oil on here, it can interfere with the connectivity. And the other thing is that you probably want to moisten your thumb with something conductive, even like alcohol gel, like something you would use to sterilize something is probably enough, so that when you hold it, that makes this more conductive. You might want to test the device, like find someone else and test it on them to make sure you're actually getting a good connection. If you can't take this and stick it down on yourself really hard and make that light go out, you might want to contact our customer service to double check and make sure there's not something going wrong there. Sometimes if these are dropped, there is a wire in there. Sometimes that it's not a hard fix, but sometimes there's a wire in there that has come loose a couple of times that I've seen in the past, and sometimes that needs to be reconnected. Chances are, if you just moisten your skin on your thumb, it's going to help. All right. What else we got here? Ooh. How would you treat nose surgery when you don't know where they made the cuts? That's an easy one. You're just going to go on, you're going to pretend like this is a scar. You're going to go all up and down the nose. So you're passing the current back and forth through the nose. Just start here and work your way all the way down. So up and down 3 times. Just keep going back and forth. That's going to pass the current through there, and that should help deal with that quite well. Oh no, Jessica, you had the wrong time zone. Well, Jessica, the nice thing is we do these like every week or two. So you can certainly sign up and watch this again. That goes for all of you guys. But also you're going to get an email tomorrow that allows you to view this as many times as you want to. So you can certainly pay attention to it then. But come back and, come back and take it again, and you're fine. Let's see, Elaine, can you explain how one would treat endometriosis when you have lesions on the inside from surgery? So you're going to treat over the back, over the nerve roots that innervate that area. You're going to treat all over the entire bladder. So here's what I would recommend. Pretend like you've got a scar that runs from here to here, and then one that runs from here to here, or a little bit lower from here to here. So treat up and down 3 times and treat back and forth 3 times. And that will get a lot of the adhesive stuff in there. You can actually treat very deep abdominal adhesions with these devices. That's one of the benefits of this over needles. You can't go jamming needles down in somebody's tummy because you poke holes in things that don't need holes in them. The nice thing is we're using electrons, and because we're using electrons, you can pass them deep through tissue without any noticeable change, except for repolarizing scar tissue, which is nice. How long after a scar is created can you begin treatment? Immediately. Like when my dad had his knee replacements, I started doing the day of. It was dressing over it, so I had to be careful of the dressing, but I just kind of lifted the dressing up and went on either side of it and bounced the current back and forth through there because it actually speeds up the healing process. Can treatment be used for menstrual pain? Yes, there's a point called spleen 6 down on the ankle that is really good for menstrual cramps. Spleen 1, which is on the inside corner of the big toe near the nail, is also used for menstrual cramps. And you can also use a point called gallbladder 41, which is between the 4th and 5th metatarsal. That's not a bad one to treat either because that's a win point for sudden onset pain, and menstrual cramps tend to be rather sudden onset. Would you go over using during labor and delivery? If you were using this during labor and delivery, there are a series of points you would treat kind of in a cycle. So it doesn't matter which one you start with. When labor is just getting cranked up, you can treat on top of the head, which is governing vessel 20. You can treat gallbladder, what is that? Gallbladder 21. Let's see here. I don't remember my points. It's a gallbladder point up there. No, I think it might be a bladder point. It might be bladder 21. On the tops of the shoulders right here, that pushes energy down. You treat large intestine 4 on either hand. Then you go down to the feet and treat spleen 6. You just kind of work that as a circle. Just cycle through those again and again and again. Do keep in mind that once labor starts, you're kind of limited in what parts of the body you can get to because there's people doing things, or doctors and nurses and stuff. But you can get to the ankles sometimes, and there are points on there that are good to treat. If you are ready to go into labor, it works pretty well. If you are not ready to go into labor, you're really not going to get much out of it. But I can tell you that it does, properly done, it does speed up delivery time to the point that by the time you want an epidural, it's too late. You're already there. What are common uses with children? Oh, gosh. When my kids have had fevers, I've used this. My son nearly died last year. That was kind of fun. He had a reaction to, I don't generally give my children antibiotics because you're terrible for your gut, but he had a really bad infection that cropped up, and I finally decided to give him an antibiotic that was prescribed to him. And just to be careful, I gave him half of the antibiotic, and I live kind of out in the country, and he had a really bad respiratory reaction. He started really having shortness of breath. And like it was one of those things that was really serious at the moment. And what I did was I used this, and I went to the outside corner of the thumbnail here, there's a point there called lung 11. Excuse me, it's on this side. So these points, if you take your thumbs and put them together like this, the points kind of kiss right there. Lung 11 is an emergency respiratory point for asthma attacks. So I kept using it on him over and over and over and over again. Each time I'd use it, he would be able to breathe a little bit, and it would start to kind of close in. The whole time I was jamming Benadryl down him to get him opened up. But in the meantime, I used that to keep him opened up. And once the Benadryl kicked in, he was okay. So it actually works quite well. Other things I've used this on my kids, bruises, there are acupuncture points for bloody noses. Gosh, my daughter, I've used it for her menstrual cramps. If you have a kid who has like spotty periods, they won't start on time or won't stop on time, you can treat points like spleen 6 to help either stop it or start it. I have used it for headaches in my kids. I used to use it for when they get colicky as babies. I would also use it. I had a stepdaughter who was autistic, and we would use acupuncture points to chill things out for her. That was actually quite helpful. It made school a lot easier for her because fear is a really big issue for autistic kids. They tend to be overstimulated, and it really calmed things down quite a bit. All right. When will you be able to buy the protocol? Oh, wait a minute. Let's see here. Does the system work for tinnitus? You can say tinnitus or tinnitus. I've heard neurologists say it either way. Yes, it does sometimes. And I can't exactly tell you which cases it works in and which cases it doesn't because I can't predict it. I've had amazing successes with this with tinnitus. And I have some cases where I absolutely failed miserably. And interestingly, some of the cases where I thought weren't going to get better actually got better. People had bombs go off near them and stuff like that. I was actually able to fix a few of those. So yes, there are protocols for it. And it can be helpful, but it isn't always. When we'll be able to buy protocol books? Well, some of the protocols we have, like our concussion, your book should come with this. The book says Natural Health. It's in the flappy, like your case, your black case that the unit comes in. There's a little if you open it up, there's a little flap right here, and under there you will find this book called Natural Health. In there are protocols, everything from shoulder pain to gout to cervical spondylosis to ankle sprains, menstrual cramps is in there, and PMS, neck pain, sciatica, shin pain, shoulder pain, thigh pain, thumb pain, wrist pain. A lot of protocols in here. Some of our stuff, like concussion protocols and stuff, are proprietary. It costs us literally hundreds of thousands of dollars to develop those with the research. So for those, you do have to take those courses. We still haven't made our money back on doing the research for those particular concussion protocols. So some of our protocols do come with the workshops that you take. And I believe they are working on setting it up so that you guys can go by individual protocols. So let's say you wanted to treat, I don't know, like plantar fasciitis. You'd pay, like, I don't know, $1 or $2 or whatever just to get that protocol. But they've got to get all that stuff set up online, and that's actually taking a while. So I wish I could tell you when that would be available, but I don't really know. How would you treat a Baker's cyst? Well, Baker's cysts are on the back of the knee. So what I would do is I would treat the low back. I would treat the nerve roots that innervate that area. So I would look at my handy dandy dermatome chart. That should be like S1 and S2. It is. Looking at one of these. Then I would go treat around the entire cyst itself like it was a scar. I would treat an acupuncture point on the back of the knee called bladder 40, which is dead in the center of the crease of the knee. That's a good acupuncture point back there. And then I would look on the foot at the corner of the pinky toenail. There's a point though called bladder 67, which is the end of the bladder meridian. The bladder meridian runs through the back of the knee, so that's called a Jing Well point at the end of the meridian there. So I would treat that particular point. Mostly I would spend my time working around that cyst though. All right, let's see what else we've got here. How frequently do you do treatments? And how many for breast explant scars? All right. So any treatment I do, if it's something really acute, like surgical acute, I like to treat it every day. When it was my dad, I was treating him a couple of times a day. If it is a chronic pain type situation that is not particularly aggravated, it's just ongoing pain, it's good to leave 48 hours between treatments because it does take a while for everything to happen. So this continues to work on your system for a while after you do it. Let's see what we got here. For breast, okay, so explant scars tend to be incredibly painful because a lot of stuff gets stuck around there. I would just leave, a day or two between treatments and you should be good. It is incredibly helpful for that. The worst explant scars seem to be butt implants, or butt explant scars. Those tend to get really painful and really uncomfortable for people. So those are good ones to do. Any ideas for kidney problems with low GFR numbers? Yeah, GFR numbers. I treated a guy yesterday who has chronic kidney failure, and we did a lot of low back. We treated because in acupuncture, the kidneys are innervated at L2-3. So we did a lot of treatment there. We treated a lot of kidney points around his ankles, like kidney 3, which is a source point for kidney energy. We treated over his entire tummy, like he had one big scar there, because he actually did have a hernia repair scar there, and that can interfere with your energy. I treated from front to back, so I put one unit over his kidneys and one over his tummy, had him laying on his side and bounce current back and forth through that way. So anyway, he felt a lot better afterwards. I'm not sure what the numbers are going to look like, but we will find out. But you can definitely increase the kidney energy. All right. I do not see any other questions here. So does anybody have anything they want to ask in person before we move along? You guys good?
Sorry. There was just 3 questions that Elaine asked close to the end of the chat window, if you might have missed those.
What do they say? I'm sorry.
If you want to treat a dog with long hair, you need to trim it, especially like for dogs with undercoats.
Okay. So here's the deal with treating animals. You do have to be able to touch their skin. You don't really need to trim their hair, but you do need to get skin-to-skin contact. So typically when you're treating a dog, unless you're treating a scar, and usually scars are surgical sites, there's usually not much hair around them because usually surgical stuff. But you need to be able to touch an area of their body that you get good skin, get good skin contact. This will work through the hair. You just touch this down on the skin, that's fine. But your skin needs to touch their skin. So if you get kind of under their armpits or kind of inside their ears, like those are areas where you can touch skin so you're grounded well. Other than that, it's fine. My sister's dog actually went down some years ago and they thought they were going to have to put it to sleep because the dog was in so much pain. It had terrible shoulder pain. They'd done injections and all kinds of stuff. It just wasn't getting up or doing any better. So I went over there and I treated that dog. I treated around the entire area. So what I did was I treated the spine like I would on a person. So I treated on either side of the spine, hit the nerves that go to that area. And all the acupuncture points on dogs are laid out the same way they are on people. You just have to remember that they have longer feet than we do. Like a dog's ankle is actually way up. So what looks like their knee is actually their ankle. But anyway, on the back, on the front, it's a little more normal. So I treated around that entire shoulder as if it were like a scar kind of thing. And the dog actually got up after the treatment and was fine. And she got another 2 or 3 years before she died of old age. So it is quite effective. And you can actually online, you can buy charts for dogs and cats. I had a cat years ago who was in kidney failure, and I took it to my vet, and she said, your cat's really, you got 2 or 3 months, and this cat's probably going to die. So I started treating acupuncture points on the cat. And after about 3 months, I took the cat back to the vet and she checked the cat out and she said, I don't really understand this because your cat doesn't seem to be getting any worse. But this is great. I said, well, I'm treating acupuncture points on my cat. She said, well, I don't really believe in acupuncture. I said, that's fine. I'm going to keep doing it. She said, yeah, go ahead and do that. Well, a year later, my cat was still alive and she was skinny, but she was happy. She wouldn't have any pain. She didn't have brain fog. Like she was quite healthy. And I went back in for a checkup and the vet said, yeah, if this were any other cat, I'd say this cat should have been dead, like 9 months ago, but your cat's still alive. I said, well, I'm still treating acupuncture points. She said, well, I don't really believe in acupuncture. But then about 3 months later, she called me and she said, hey, can you stop by my office for a minute? I know her. She's helped me a lot raise squirrels that have fallen out of trees and all kind of critters from the woods. So we have a pretty good relationship. So I stopped by her office and she said, well, I was at a vet conference and I got you these. And she handed me a dog and a cat acupuncture chart, even though she doesn't believe in acupuncture. So anyway, in that particular case, it was actually quite good for a cat and kidney failure. So there's my pet story for you guys. I have treated quite a few horses. Horses respond quite well to this treatment. Obviously, don't get behind them so they will kick you and make them aware of what you're doing to them. This does not hurt as much as a lot of the flies that bite them, but the noise makes them a little fidgety sometimes. So you need to, get them used to it before you do that. All right. So that's one question about the dog. What are your other two questions?
So if you've got a few different issues going on, what is the best way, or where do you start? Is it kind of rule of thumb to start with your scars first, or something else?
In a perfect world, like if you were treating someone, so scars act as a stressor to the autonomic nervous system. So in a perfect world, you release every scar on somebody before you did anything else. The reality is most of us don't have that luxury. We have to do things to get people out of pain quickly and then treat the scars as we go. But if I had my choice, when I saw someone, I would treat all their scars first and get all that done. And then I would move forward with everything after that. And once I got the scars done, depending on what it was, if it was a concussion, we got a whole course for that. I would do a lot of head treatment, but most other things I would move to the back after that and treat along the nerve roots for that innervate that area. And then I would go and treat jing points on the fingernails and toenails because those are the ends of the meridians and they're very powerful and they tend to run through those areas. And the actually last thing I would do is treat over the area where it hurts, because you can use these devices. You can stick them on some place that hurts. Like you can be completely ignorant of how these devices work. You can just turn it on and stick it where it hurts. And generally speaking, it makes it feel better. However, that's not long-term. So I like to get long-term outcomes. But if you do this in an area where it hurts, it generally makes it feel better. And if you do that first, you're not really sure if if that's helped or the other things you're doing helped. So we start globally and work in from there. And that way it allows us to gauge which part of the protocol worked the best. And you may get to the end of it and find that just treating around the area gives you the most relief, and that's what you need to do. But you might find that treating over the nerve roots does a much better job, and you wouldn't know that if you started with treating around the area that hurts. So does that help a little bit?
Sounds great. Thank you.
Sure.
Just the last one, when treating scars, how many treatments do you do? Is it, like you mentioned, it reduces the density by about 20%. So is the rule of thumb going 5 sessions per scar, or?
It's about 5 sessions. Typically 5 sessions will get you what you need. If it's a burn scar, it's going to take longer because you've got just a lot more tissue. But 5 sessions, I would say, is about standard for most things. So if you had to tell somebody, like if they were trying to price it out, like how much are they going to spend with you? About 5 sessions worth.
Perfect. And just the last one around that. So you mentioned that you're doing about 10 beeps per point as a minimum, but if you do more, is there any, negative effects around that?
No, not negative effects. It actually is a positive effect. You could spend a lot more time in that area. I'm just trying to give you guys, like, a lot of the people who use this equipment work in clinics, like physical therapy and occupational therapy clinics. They work in professional settings. And in those particular settings, things are done, and the billing is done in 50-minute increments. So there's a billing code for each thing. Typically, insurance companies will pay for 4 billing codes per treatment session because some genius along the line figured out that, oh, you only need an hour of treatment on any given day. And that's all they're going to pay for. So we need to have our protocols pretty concise so that they can do like a quick scar treatment and then still have time to do the rest of whatever, gait training or whatever else they might be doing during the course of the treatment itself. So that's why you would end up doing it that way. But if you have more time to spend, that's even better. All right.
Thank you.
Any other questions, guys? All right. Well, it is 9:04 right now. So again, look for an email from us tomorrow and do join our Facebook forum. That's a great thing to do. We will send you guys, we will promise we won't flood you, but we will send you emails to let you know when we have upcoming courses. Some of them are online, some of them are in person. I'm teaching at Vero Beach this weekend, a SCAR course, if anybody's down there and wants to take it. Looks like we got about 15 people signed up, so we got room for a couple more. It's a smaller facility, so it's a nice intimate environment to learn in. There are not a million people there. Let's see what else we got here. All right. Well, thank you guys for coming out. I'm going to go home and spend some time with my kids and then get some sleep so I can go to work in the morning. So thank you. Have a nice evening, and I'll talk to you guys later. Bye-bye.
Thank you.